Hi there. If you've got lower back issues and leg pain and you know you've got a disc herniation, then I've got something that might interest you. So hi everyone, I'm Dr. Lisa Smith from Errol Street Chiropractic in North Melbourne. And in today's video, we're actually going to go through a case history, a Chiro BioPhysics case history about a lady that has perhaps a similar problem to what you might be experiencing and the help that she had with Chiro BioPhysics. Now in our office, we are a Chiro BioPhysics office here. We see about 1 to 2 people a week with chronic lower back problems and leg pain. So that pain that really interferes with sleep and just daily activities and pretty much everything. So generally these people have had, we're talking about disc herniations where they know through a MRI, they've had imaging to know that there's a disc herniation, and they're not surgery cases. But there's a bunch out there that, you know, are still in a lot of pain and, you know, surgery is not the answer. So Chiro BioPhysics can and often does provide some relief if they're the right fit for this sort of work. So we do get people that come in with this chronic pain, and a lot of the time they've seen, you know, physios, they've seen osteos, they've even seen chiropractors and have had some relief, but they're not really getting that real relief for them to get back to their normal activities. We do know with research that 50 to 80% of disc issues, or some disc issues, do get relief with chiropractic care, but not all of them. And that's really what we're going to talk about today in this video. So you may have seen some of our previous videos because we've gone through the relationship between a lack of the normal forward curve in that lumbar spine, that is our shock absorption, and we've seen in journals like Spine, written by Chun and et al. And his colleagues, about that association between a loss of curve, a loss of shock absorption, and issues in the lower back. We've seen also a meta-analysis that's been done in another JMPT journal recently, and this has been done by medical people, that 78% of cases where there's a lack of lumbar curve have related disease issues in the tissues around that lower back, which relates to pain, disc disease, and you know, chronicity. So it is a big problem, and we often see it with disc issues. So in this particular case, it was a 23-year-old woman who's had 5-year history of chronic lower back, leg pain that was giving her lots of issues. And she'd seen a chiropractor in the past. So this approach, this Chiro BioPhysics approach, is really a spinal rehab approach that is looking at allowing that spine to get to closer to a neutral alignment. So what they found was that she did have a lack of normal forward curve. So the normal curve is 40 degrees forward curve, hers is 25. Now, the other thing that they found is that she had some neurological signs. Her reflexes weren't great, her muscle strength wasn't great, but her orthopedic signs were showing that there was definitely some nerve irritation. So her course of care included what we call in the Chiro BioPhysics is mirror imaging adjustment. So there are special adjustments that we do on a chiropractic table, and she had traction. So what you'll see here is the Denerol table. You see these arms here, and this is what she was on, or something similar. So there's a pulley system. It's a 3-point pulley system that was used to help to increase the curve in her lower back. Obviously not this one, but one very similar. So she responded really, really well. Her lumbar lordosis improved from 25 degrees to 36 degrees, so it's an 11-degree increase in her curve. Her pain became pretty much negligible. Her orthopedic testing and her neurological signs had fairly normalized. And, you know, this was obviously one very happy lady. So if you feel that you're not getting results with your care and you haven't considered Chiro BioPhysics, then maybe now's the time. So if you've got any questions, I'm more than happy to, you know, for you to message me or message me privately, send me an email, and you know, there might be something that we can do to help. All right, everyone, take care. All the best.